Question 173. This 42-year-old gentleman who had a high-speed RTA presents acute UTR. He has severe chest pain radiating to his back and is hemodynamically unstable. For suspected thoracic aortic injury, the most common finding on chest radiograph in this patient is indistinct aortic arch contour. So indistinct aortic arch contour shows suspected aortic injury after RTA. Question 174. 50-year-old smoker underwent a cardiac examination which revealed emphysematous spaces more than 1 centimeter in diameter with central broad line and without definable wall surrounded by normal bilaterally in upper lobes. What type of emphysema is patient suffering from? Smoker has central acinar emphysema. Smoker always has central acinar emphysema. Question 175. 35-year-old man with known squamous cell carcinoma of the larynx was noted to have some large level 2 nodes on CT and ultrasound has been arranged. What feature on ultrasound would make most suspect that they were enlarged due to infiltrating metastatic carcinoma? Round shape. Round shape means metastatic carcinoma. Non-squamous cell carcinoma has enlarged L2 lymph nodes. What will make you suspect that they were enlarged due to infiltrating metastatic carcinoma? Rounded shape is malignant. Question 76. 1-year-old girl presents A&E with heart cuff, fever and stridor. A lateral X-ray shows normal supraglottic structure. The X-ray shows narrow supraglottic airway, but most likely diagnosis group. The chest X-ray shows narrowing or Koch bottle sign of the supraglottic airway, but likely diagnosis group. Narrowing of the subglottic airway and normal supraglottic structure, diagnosis group. 77. A 66-year-old female is found to have a small, well-defined anterior mass on this radiograph which demonstrates homogeneous soft tissue density with some variable calcium on CT. On MRI, it is isolated skeletal muscle. On T1 variant image has slightly increased signal. On T2 variant image most likely to be thymoma. Isolated entrance to skeletal muscle is diagnosed as thymoma. Isolated entrance to skeletal muscle diagnosed as thymoma. 78. 60-year-old woman with rheumatoid arthritis presents with flu-like illness and non-curative cough. Her symptoms have not responded to an appropriate course of antibiotics. An SRCT is performed and demonstrates widespread mosaic perfusion, which again CT finding would suggest diagnosis of obliterated bronchiolitis rather than diffuse pulmonary hemorrhage, reduced caliber pulmonary vessels in the hyponatremia areas. Now, which CT finding would suggest diagnosis of obliterated bronchiolitis rather than diffuse pulmonary hemorrhage, reduced caliber of pulmonary vessels in the hyponatremia area. It would suggest diagnosis of obliterative bronchiolitis rather than diffuse pulmonary hemorrhage, reduced caliber pulmonary vessels in the hyponatremia area. 2079. 4-year-old lady with dry cough of 2 days. She has received chemotherapy and radiation for right breast cancer 1 year back. On assessment, she is tumor-free. However, new finding was reported on chest X-ray. Most common likely finding on chest after 9 to 12 months of treatment is pulmonary fibrosis because post-chemotherapy. Patient went post-chemotherapy for right breast cancer. On assessment, she is tumor-free. However, new finding was reported on chest X-ray. Most common finding after 9 to 12 months of treatment is pulmonary fibrosis. 80. 46-year-old woman with a history of breast cancer presents with position of the chest radiograph shows radicular shadowing in the left lower zone. As our CT shows diffuse septal thickening and nodularity in the left lower lobe, we're most likely diagnosed with hepatitis carcinomatosis. History of breast cancer with precision cuff, then post radiography shows radicular change in the left lower zone. As our CT diffuse septal thickening and nodularity in the left lower lobe, diagnosis hepatitis carcinomatosis. 81. A 6-year-old man presents with pain in the right arm and right side of the neck. His X-ray cervical spine revealed dense pleural shadowing of the right lung apex and eroded pedicel of post-thoracic vertebrae. The symptoms are due to tumor having involving fractures. The patient, 46-year-old man with pain in the right arm and right side of the neck. His pancreas tumor. And then his X-ray cervical spine dense pleural shadowing of the right lung apex. So shadowing of the lung apex is pancreas tumor. And then it may involve the brachial plexus. 82. An asymptomatic 49-year-old gentleman on routine chest examination had a large round mass in the right cardiopulmonary angle. Subsequent CT for circumstances revealed an oval mass of 2 grams of fat density separated from the heart below the tracheal bifurcation, most likely diagnosed pneumococcal hernia. Because mass in the right cardiopulmonary angle, and then he can show oval mass 3 grams of fat density separated from the heart below the tracheal bifurcation, where most likely diagnosis. Below the tracheal bifurcation, most likely diagnosis is pneumococcal hernia. Most common important DD for cardiopenic angle mass and organic hernia developmentally defect and anteromedially in right 90%, left 10%. Okay, okay. In options, there is no pericardial fat pad, so most likely there is organic hernia in the separate from heart below the tracheal bifurcation. And then hint is the below the tracheal bifurcation, so below tracheal bifurcation most likely organic hernia. Question number 83. A CT chest of a young female reveals a pericardial mass. This is contiguous with the heart border, elliptical, thin wall, and contains no internal substrate. Every attenuation is 17HU and does not enhance pulse control, most likely diagnosis pericardial cells. When it comes to pericardial free angle mass and then 17HU on CT scan, most likely diagnosis pericardial cyst. 84. 70-year-old man recently underwent laparoscopic prostatectomy. He is now presented to the emergency department complaining of shortness of breath, dry chest pain, and hemoptysis. D-dimer levels were measured and found to be significantly elevated. A chest X-ray is performed as part of the initial investigation. The final most likely chest X-ray finding, not just X-ray. Because he underwent laparoscopic prostatectomy and then now presents emergency department complaining of shortness of breath, dry chest pain, and hemoptysis. D-dimers were measured and found to be significantly elevated. A chest X-ray is performed as a part of initial investigation, which is most likely chest X-ray finding, not just X-ray. 85. 35-year-old female presents with worsening headache and facial droop. Her chest radiograph is abnormal, non-contrast, enhanced CT brain and remarkable MRI demonstrates left phalangeal thickening and enhancement, particularly around the basal stern. Enhancement extends along the right 7 cranial nerve and along the optic nerve. There are several small epithelial parenchyma enhancing lesions found bordering basal stern, most likely diagnosed sarcoidosis. The sarcoidosis usually involves the optic nerves, optic nerve, and has worsened headache and facial droop, so diagnosed sarcoidosis. 86. 35-year-old gentleman presents with progressive shortness of breath for 1 year. On chest X-ray, there are bilateral peripheral reticular opacity at the lung basis. On SRC, there is subpure basal reticular pattern of honeycombing. Most likely diagnosis is urinary pneumonia. The subpure basal reticular pattern with areas of honeycombing is seen in urinary pneumonia. Question number 87. A 28-year-old man being investigated for hemoptysis. He has a history of sinusitis. Full blood picture is normal. He is referred for CT of the chest, during which intravenous contrast was withheld by the radiographer due to a reduction in estimated CFR. He revealed bilateral nodules in the perivascular distribution, some of which were cavitation. There are peripheral wedge-shaped areas of consolidation. There is also areas of bronchial stenosis and thickening. No myasthenia or high nephropathy is present, most likely diagnosed dermatosis. Now he has all hemoptysis, and he also has sinusitis, and then he also has lung symptoms, so diagnosis dermatosis. Sinusitis in nose, cavitary nodules in lung, reduction in GFR in kidneys, and the peripheral wedge-shaped areas of consolidation, so dermatosis. 88. 30-year-old gentleman with history of rotator action was brought to the emergency department with TCS of 6515. He had an intracranial hemorrhage with a fracture of parietal bone and 36-hour dead chest X-ray and diffuse airway shattering, which remained static for the next 1 week. The most likely cause of diffuse airway shattering is damaged capillary bed and development of hairline membrane. Because the patient is going into RTS. So, most likely cause of diffuse airway shattering is damaged capillary bed and development of hairline membrane. 89. A neonatal with a history of worsening cyanosis and respiratory distress has a series of chest radiographs taken. These chest radiographs reveal a solid left upper lobe mass, and over the course of 3 weeks this becomes irradiated. Because mediastinal strip is seen as the mass enlargement, this is most likely diagnosis congenital lobar emphysema. Again, neonatal with worsening cyanosis and respiratory distress has a series of such X-rays taken. These chest radiographs reveal a solid mass, then afterwards it becomes irradiated, and mediastinal strip is seen as the mass enlargement, most likely diagnosis congenital lobar emphysema. 19. 6-year-old boy presented with cough and fever for 1 week with clinical suspicion of chest infection. The chest X-ray revealed well-defined lesion with multiple airfield cysts on the left lower lobe, hypoplastic left lung with sharp IB diaphragm, most likely diagnosed cystic aortic malformation. It's same as pneumonia, but instead of consolidation, there is a well-defined lesion with multiple airfield cysts in the left lower lobe, hypoplastic left lung with sharp IB diaphragm, most likely diagnosed cystic aortic malformation. The cystic aortic malformation right upper lobe. When locked and assisted, let and right homogenized and marked by adjusting the shift to the left. Thymus, thymic cell sign, thymus in child. Now T1, central lobar nodule with branching pattern, history of tuberculosis, 3 in birth. Central lobar nodule with branching pattern and history of tuberculosis, answer 3 of birth. 92, 45-year-old computer software engineer presents with drooping of both eyelids and slurred speech for 3 weeks. The symptoms become progressively worse during periods of activity and improve after a period of rest. His lab scan showed red cell aplasia. The patient request for an CT scan chest. The most likely finding on CT in this case is right upper lobe mass because diagnosis is thymoma. And thymoma related to red cell aplasia in the thymus and usually appears as an opacity in the right upper lobe. Thymic cell sign. So first engineer had drooping both eyelids with thymoma sign of symptom and it appears as right upper lobe mass. 93 squamous cell carcinoma most appropriate for staging is PET. Squamous cell carcinoma most appropriate for staging is PET.